Welcome to Mobility Moment with Dr. Martinez. So these are some of the exercises and stretches I do to warm up and just create more mobility in my shoulders, in my neck, and in my hips. So I'm just gonna take you through a routine. Hope you guys like it. Let me know if you have any questions. So what you're first gonna do is you're gonna grab a band that's kind of lengthwise like this. Let us know if you have questions about where to get this band. So what I'm gonna do here is I'm gonna do what we call a chest opener. My palms are gonna be up. My arms are about shoulder width apart. And I'm just gonna bring the band backwards, and then I should feel a little stretch in my chest area, and then if you turn around you're going to be activating the shoulder blades. So typically what I do is I do about 10 or 12 reps, and I already feel like my upper back and chest actually open up nicely. I come around as well and put my palms down, and this gives you a little bit of a different activation. Works different muscles. I'm going to do about 10 or 12 reps here. So if you're doing this along with me, you're going to feel a little burn, but your muscle shouldn't be like overly fatigued. So if you're kind of struggling and your form's off, you actually want to do the last reps. So this is a pretty light band. I'm not going anything heavy. Again, we're just trying to get some blood flow to the muscle and just increase some of that mobility. Again, I'm going to do 2 sets of 10, palms up. Again, I'm doing about 8 to 10 or 12 reps at the most. Again, nice chest opener, keep your core nice and tight. You want to keep your neck from kind of coming forward like that. Just keep everything nice and relaxed. Okay, and that would be my first exercise that I'm going to do. The next one that I do is also a little bit for the back and the shoulders. I sometimes do this kind of to warm up the shoulders if I'm going to do like a workout. So typically what you do is you can grab the band and kind of wrap it around something that's fairly sturdy. With this band, your palms are going to be kind of facing each other. Again, nice tall posture, and you're just going to bring the arms back. And what you want to do is avoid kind of doing this motion here. You want to use a light enough band that is light enough where you're not struggling your shoulders as well. So I already feel my shoulders nice and warmed up. I feel all those muscles that kind of help support the posture nice and activated, which is kind of the point of the exercise. So then, now that I'm warmed up, I'm gonna come here. We call this like a doorway stretch. I guess this is like a hallway stretch. So the key with this one is you don't want to be too aggressive with this. I'm gonna place my, you can see my elbows are about parallel to the ground. I'm gonna lean into it with one leg in front of the other, and I'm gonna feel a little bit of a stretch, something around here. Feel a little bit of a stretch kind of the muscle here, that's the pec muscle. You don't want to be too aggressive kind of doing that because you could actually injure your shoulder. And then I'm going to hold that for, typically I tell patients in the office, you want to hold it for about 20 seconds. I'm just going to hold it probably for a few seconds today. I'm going to repeat it on both sides. Again, kind of leaning forward. This one I tend to do often throughout the day just because as a chiropractor, we're always kind of leaning forward, and again with posture, it's kind of a constant thing where we want to keep everything open up. So again, I feel everything nice and loose here. So now I'm going to show you a few like lower back hip things that we do. We do these quite often in the office, and you've probably been around here in the exercise room. We tend to get tight hips a lot of times. We get tight hips sometimes like after workouts, so like if we do like a leg workout or a lot of walking or running or whatever you do for exercise, the muscles around the hips get kind of tight. So then pretty simple exercise. Again, we're gonna hold this for about 20 seconds. Leg's gonna go over the other, and then the key with this one is you don't wanna over rotate the knee. You wanna hold down to the top of the ankle here, above the ankle, knee, and kind of pull forward like this. And again, you're going to hold it for about 20 seconds. So I feel that kind of on the side of the hip. I'll actually change legs here so you guys can see. And I'm actually a little tight today. Normally I can go a little further, but actually I haven't done any stretching today because I was waiting to do it with you guys. And again, I would do that for about 20 seconds as well. Next one that we use quite often in the office, stretching the hamstrings out. So you're gonna grab like a belt or an exercise band, bring it over here, kind of above the, not the heel, but kind of like the midfoot area. You could keep one leg bent or one leg out. Today, since I'm a little tight, I'm gonna bend my leg, and we're just gonna stretch it out like this. And I feel that nicely here in the back of the legs. Hamstrings actually go past the knee and they kind of connect to the hip and the buttock area. And I'm gonna do the same thing here. So I feel that nicely here. Sometimes people get a cramp when they do this. If you do get a cramp, take a rest, or you're probably stretching too far. That means that hamstring is pretty tight. The next one's one of my favorite. This is one that I do often when I'm at home playing with the kids. We call this a child's pose. There's different variations, but the key with this one is you should feel a little bit of stretch in the lower back and in the hips. You can put your palms or your hands you can do this on the floor. I'm gonna do this on the table. And you're just gonna lean forward like this. And again, you're gonna hold that for about 20 seconds. You should feel that nicely in the lower back. So that's a little bit about my routine. There's depending on what's tight, I tend to do other things as well. So what we're doing with this video is kind of like a series. We're gonna try to do twice a week. We're gonna shoot for Tuesday and Friday mornings. Should be the same time, where we're just gonna take you through like my exercise routine. This is also a way to kind of hold myself accountable to make sure I'm being consistent with my stretches. So you guys will be part of that as well. And then from time to time, it'll switch a little bit. And really, like, the key is just to ask questions, follow along, and if there's anything you have questions about, obviously if you're a patient, reach out to the office or anything like that. So I think that's it. Thanks, Danny, for recording. We'll see you guys in the next time.